patients already had something surgeries before, or the kidney mobility is not well. So we may, you can like distort that fascia and there is a small bleeding. That's what happens. So that's why we need to be careful. So now we are going in the kidney, that what exactly we'll be finding as an endoscopist, that what you should be knowing it, because that was from the outside. So in the kidney, if you see that calyxes are there, they are formed, there are various arrangements, upper, middle, lower, and then some minor calyxes. We'll see that how these are formed. And then they go into the funnel tube like a pelvis, which has its own, you can say like diameters, we will discuss, and then into the tube. So that's the basic thing is, this is the look which you are seeing from outside, that how it looks like, but what we are interested, what will be inside. But before we go into the inside, I'll show you another thing like a vascular supply, why it's important. Vascular supply, because the anterior and the posterior divisions, we all know that supply has anterior segments, posterior segments, upper, lower. And then if we see more towards lower end, so that's what we are more interested, that when the segmental arteries are there, they go into the interlobar, in between the infundibulum, then goes towards high as periphery, arcuate arteries. And when we do the punctures, these are usually happen in this area. So that's why these are end arteries. When we puncture it, obviously we'll lose some nephrons. So that's why if you have the anatomy in mind and where the calyx is facing, you will do the little damage, because these cannot regenerate. Then again, actually what you can say we should be knowing that what difficulty we will get in our ureteroscopy or percutaneous approaches. So there are various types of classifications you can see, which has gone from olden times when there was only IVU there. So people have tried to, you can say like internal renal pelvis, external renal pelvis. So that was just a basic type of calyxial anatomy, they said. So then later on, when the technology improved, they did some casting and etc. So then they, you can showed there is a division of the pelvis, bifid pelvis, triphasic or multiple. So on that basis, they try to emphasize that not every kidney is the same, and you might find the difficulty. So that was the thing. Then there was